Hello, and welcome to Voices in African Health. This is the podcast where we explore the big questions shaping global health and connect them to realities across Africa's health systems, hearing directly from the people driving change. I'm your host, Sharon Quntai. Today, I'm joined by Benda Kithaka, the founder of Kilele Health, who has been working in cancer care and advocacy for several years. Benda actually began her career in marketing, but her path shifted after a personal experience pushed her to step into this space and build support for people navigating cancer. Benda, welcome to Voices in African Health. It's great to have you with us.
Thank you so much, Sharon. I'm delighted to be here.
Amazing. So to start us off, how about you give us a quick introduction of yourself, maybe give us some background, which I've touched on a little bit, but it would be nice to hear about this personal story that actually pushed you to venture into support in cancer care.
Thank you. As you're giving me a mic and I'm known to talk on mic forever, I'll just abbreviate it I'll truncate it so that our listeners can also just get insight as to why I came into this field. So Benda Kithaka, Kilele Health, founder and executive director. I came into this field 15 years ago. I've been working in advocacy for 15 years. But before that, I had done another 12 years of marketing and corporate communications, as well as research. I came into the field because one day, random, I was working in marketing cars, Toyota, and my sister was told she has cancer. And so my brother-in-law is the one who called me to say, I'm hearing, what do we do? And of course, it came with the usual shock, fear, the thought that this could mean death. And fast forward to 1 year later, she had been treated, she had recovered, she had gotten a baby. And it was unbelievable for me because initially I thought cancer was a death sentence. So here we are. Not only has she gotten treated, she's recovered. She didn't need chemo or radio. And she had conceived to have a baby. That was an aha moment for me. And so knowing my skill set in communications and knowing my skill set in marketing, I thought, why don't we harness that skill set to bring about social change and communications to demystify the diseases and be able to make an impact. Shock on you, 15 years later, I'm still here talking about it.
Wonderful. And that's the birth of Kilele Health. So could you tell us a bit about what is Kilele Health? What do you do? Why does your work around cancer matter so much, especially in Kenya and beyond?
Actually, Kilele Health was born in 2019 as an idea, and then 2020 as real action. Before that, I worked in the community with another organization that we had co-founded with 4 women. And we were going to villages, sensitizing women, doing community outreach, and also actually doing medical outreaches. So we would go set up camp, create a lab, get pap smears done, read in the village, and then bring the results and navigate the ones that needed treatment. In 2019, a friend of mine died. She was a cervical cancer survivor. She had been with me in the advocacy trenches for a number of years. And she had been a vocal voice of survivorship. When she died, a huge gap in realization came to me that we're constantly telling women, go to the village, go to the hospital, get screened, you will be fine.
Right.
But truly, nobody follows up as to whether they're fine, as to what situation we're sending them to the community in. And so that realization, again, birthed in me the need to address survivorship. And I thought the best way to do so was climb Mount Kenya with survivors and caregivers to show that cancer is not a death sentence, but also to tell society and communities what they can do to prevent. It was during COVID-19 time, the lockdowns. It was not easy.
Yeah.
It was a huge challenge for me to get the survivors to believe that we can actually climb a mountain, to prepare. These are people, some of them had never left Nairobi. Some of them live in informal settlements. And so low-income households, this is COVID-19, there is a lockdown, and we're talking about going up a mountain. There is social isolation, there is a lot of mental wellness stigma. But in Kilele, those are some of the things we address. So we fashioned our programming around physical fitness to get out of the house and do something that shows communities that there is prevention or there is life beyond cancer.
Yes.
Mental wellness to address the stigma, the fear, self-stigmatization as well as community stigma around cancer. To build an awareness around the impact that survivorship can bring to the community. Survivors are people who understand the healthcare system.
Yes.
They already know where the pitfalls are. They already know how the system is serving people. So to bring that lived experience back to the community to let them know, this is my story. You don't have to go through it. We can prevent.
Yeah.
But at the same time, should you need to go through the system, have no fear. We can do something about it. I'm living proof it has happened. It can be done.
Right.
And that's how Kilele Health was born. Why our work matters. Initially, I would be the one on TV and on newspapers and mainstream media, podcasts like this one, always talking about them, they, survivorship, etc., and policy and the things that need to be done. Today, there is a shift because of the survivors and champions that we've trained. They've become, they themselves, their own voices. And so now they're the ones who actually go to mainstream media. They're the ones who go to the community. We are creating a movement of champions that bring their lived experience as a technical capacity to be able to demystify disease, to educate communities in languages they understand, to break down policies into actionable solutions, and to bring service directly to the community. And that, for me, is what impact is about.
That is amazing. That's really, really wonderful work you're doing, Benda. And I think a lot of people would be amazed to hear that we have cancer survivors actually summiting Mount Kenya. And we'll come to that because I think we really need to get into how exactly you go through that, how many editions you've had. But just to take you back a little bit. So cancer is often talked about very differently, especially in African contexts. So from your experience, what are the biggest misconceptions about cancer in Africa? And what's really the reality? You've actually mentioned or touched a bit on the reality of the survivors. So what do you think are the realities on the ground for patients and as well for families?
Well, let me start with there are so many myths, misconceptions about cancer. But the three that really stand out for me, the ones that we really need to demystify right now is that one, cancer is one disease. It isn't. Cancer is different diseases that happen in different parts of the body. The only thing is they have a similarity. One, chronic illness. Two, takes time to grow. The cells changes, takes time to grow in the body. Three, the different types of body parts react differently to treatment, and therefore also the interventions are different. And so when we talk about chemotherapy, radiotherapy, surgery, there is also some that are actually treatable. And that's the second myth and misconception that I would want people to understand. Not all cancers are the same. And therefore some are actually preventable. Cervical cancer being one of them. With a vaccine, HPV vaccine, and also with early detection, which leads to 100% cure. That's what happened to my sister. There are others that are more invasive and more aggressive, but also we have enough technical expertise and solutions out here that can manage often to very good quality of life. And therefore, in cancer prevention, cancer advocacy, cancer treatment, early detection, community awareness that translates to action, and policy frameworks that support interventions all along, not just as start-stop programs, but actual systemic changes so that people can be able to access care. That's the second misconception. And the last one, and for me, is where we come into societal impact of cancer. It's often seen as a very expensive disease to treat.
Exactly.
Rightfully so, because in its invasive stages, when we go to chemotherapy, radiotherapy, it costs quite a bit.
I can imagine,
However, in the preventative stages or in the early detection stages, management of some cancers is actually very affordable. And so people need to stop fearing about cancer and start embracing prevention and early detection so that we have better outcomes all along. Now, what is the daily experience of patients in Africa?
Yeah.
Because of the fear, the stigma, because of the misconceptions, misunderstandings about cancer, most often what we see is a lot of struggle.
Yeah.
What we see is a lot of fear. What we see is a lot of stigma that is veiled around, if somebody has cancer, it will cost a lot, therefore we have to avoid them because they'll be coming for the little income that we have.
Exactly. Yeah.
The flip side of that is I've also seen amazing work coming from our survivorship programs where we're restoring dignity. We are demystifying the misinformation. We're actually supporting progressive uptake of preventative action. And for me, this is where survivors become advocates, and not just advocates for themselves, but also for change.
Right.
They start mobilizing communities to take action. They start speaking to government to invest in their people. And this is not just in Kenya, it's across Africa. So really, is even as we speak about the big issues in cancer, I also see a lot of progress.
That's really great to hear, because indeed, that's true. If you asked many people, the very first thing, especially from an African context, is the expense. That is the very first fear that most people get, is that how do we actually manage to treat cancer with how expensive we've heard it is. So it's really good to hear that there's a message of hope and that there's a message of survival, that there is, that someone can come out on the other side. So what would you say, given that context, what would you say are the main barriers that people face, especially when it comes to prevention, to diagnosis and treatment? And which one of those barriers do you see Kilele Health specifically helping to break most directly?
I think a big barrier is behavior change communications. Most often, many programs will focus on communication. This is the sign and symptom. This is how you can prevent it. This is where you can access treatment. This is where. Our program goes one step further.
Right.
We do community navigation. And community navigation is where somebody has found out they have something suspicious in the body, even when it's not yet confirmed as a diagnosis for cancer. Our organization has patient navigators that have been trained to be able to take these people by hand, be them from the villages or from wherever it is that they are being referred to us from, to be able to be taken by hand to the facility that will support them, or to have genuine conversations with the patients around what is your current situation, how can we help you? And in that navigation, we've seen reduction of waiting times. Because sometimes people are waiting thinking, I have to get money to get treated.
Right.
And it could be as little as get registered on the social health insurance, so that then you're able to access care. And within the waiting period, these are some of the tests that you need to do so that by the time you get to the doctor, SHA will cover, you will have the results from the tests. Therefore, it's a faster turnaround in the healthcare system. Sometimes removing barriers like accommodation. Where does a woman coming from Narok come and stay in Nairobi to be able to access care and treatment and go back to her family? Those are some of the things that we navigate through to ensure that we're removing barriers in the healthcare system. The second barrier in Africa, not just in Kenya, is the engagement of civil society organizations at inception of programs as opposed to at the tail end of implementation.
Right.
There is always the assumption that health is something that happens to us. And so a civil society who are seen as naive, who are seen as with poor health literacy, they're not requested or even advised or even invited to inform the decisions around the interventions that will come. For example, in 2022 December, just when WHO was on its third year of cervical cancer elimination, we did a qualitative research with civil society organizations, sent self-collection devices across our African network. And we sent them to talk to women to find out what does it mean to you if you were the one with this tool in your hand doing your self-examination, as opposed to going to a clinician for you to be able to get service. Now, it was clear. It's very acceptable. Why? It reduces the access to care barrier.
Exactly.
It reduces the time the woman has to leave her household, go all the way to the facility, wait in line, get seen by a nurse, get back home, wait for results in future, be told to go back again to get the results in the facility. If the woman is doing self-sampling at home, and the test is sent to the facility, and the results are being relayed either digitally or face-to-face, that's one less visit to the facility.
Right.
That's one less cost of care, because there is the out-of-pocket cost of transport, the out-of-pocket cost of childcare if she has to leave her family, etc. And so looking at interventions that can bring services closer to the woman and getting civil society engaged at the periphery in informing decisions even before we get to actioning them. That is a critical barrier, and we need to address it now. And lastly, healthcare financing. I know right now it's a buzzword. Universal health coverage, healthcare, domestic healthcare financing, localizing reach, impact, etc. As civil society and as Kilele Health, what we're doing is going one step further.
Okay.
Because these buzzwords mean a lot, and then there is always the we expect government to do.
Of course. Yeah.
However, cancer is not waiting. If we're going to wait for government to put budgets in place, I can tell you in the Kenyan healthcare system, in the Kenyan budgeting system, the budgets that will be read in June are for next year. Because the fiscal year starts in July, and therefore they've been doing the fiscal planning the whole year long, right? So if we're saying now we start advocating for budgets, we would be talking about 2028, 2029 budgets.
I see. Yeah.
Isn't it?
Yeah.
Really? Can we wait as civil society until 2028
No,
to
not
get
at
the
all.
budgets?
Yeah.
So what we need to do then is rethink healthcare financing from an all-actors perspective and start thinking innovation. Where do we get the quick buck now, and how do we stretch it to ensure that it's serving the people now, even as we wait for governments to provision? I think I've addressed quite a number.
Absolutely. You've definitely addressed that very well. And looking at how you work well, and it's good that you've mentioned health financing because we'll get into that, but looking at how Kilele Health specifically works well and closely with communities, can you just give us maybe a story or a moment that really captured, or rather has recently captured your heart in terms of human impact, especially in your work in cancer?
Oh, wow. There are many stories to tell.
Yeah.
And I like to tell stories that not only showcase the challenges, but also the triumphs that we have. Funded by Prevent Cancer Foundation in 2023, 2024, and 2025, we were able to reach over 40,000 family members.
Wow.
So men, women, girls, in a community in Bere North with awareness education and behavior change communications that translated. So 40,000 reached with one-to-one awareness and education. It reached over 1,500 women screened for cervical cancer. It reached over 2,500 girls vaccinated for HPV to prevent cervical cancer. 113 women were found to have something suspicious. Out of that, 67 were navigated through the healthcare system for pre-cancer treatment. And the others, they have continued to be navigated for access to care for invasive cancer. Not only did that result in those direct impact in the community, it also resulted in us jump-starting the referral lab in Embu County Hospital, Level 5 Hospital. Because when we realized we're sending our tests for pap smears to Nairobi, it was untenable.
Yeah.
So what we agreed was, let's capacitate that lab. Some of the equipment had stalled because of some parts missing or it needed servicing. So we dedicated some of the resources to kickstart that lab. Now it's serving the county continuously. when we realized pre-cancer treatment was necessary, through some of our partners, such as Clinton Health Access Initiative, we were able to donate some thermoablation devices. That was not in the program. It was not what had been funded.
Yeah.
But we were able to get our partners to come on board and give equipment that continues to service, the county even now.
Yeah.
And the trickle-down effect beyond that. Other partners saw what we were doing. They started coming on board.
Yeah.
So now they have programs not just in Bere North. They also have other programs in Bere South. They also have other programs in Manyata. And these are with other partners that have come on the table to say, let's create on the momentum that has been created. Sharon, that's at the grand scale.
Wow.
On the personal scale, what gives me joy is to meet a woman I've never met face to face, who hears about Kilele Health and says, thank you so much. And I'm like, for what? And she says, your team navigated me through the healthcare system, and I'm here because they acted.
Wow.
That gives me goosebumps. And that's why we keep doing what we're doing.
That's very inspiring.
Thank you.
Absolutely. Very,
Thank
very
you.
inspiring.
Yeah.
So still on the exciting note,
Yes.
you're gearing up now for the 6th edition, is it?
Yes.
6th edition?
Yes.
So, I mean, congratulations. 5 editions. That's absolutely crazy to even imagine that you've managed to summit Mount Kenya with cancer survivors 5 times.
Yes.
That's a really big milestone. And just looking at the plan that you have for the 6th edition, which I'm hoping to join actually.
Thank you. Yay.
Can you tell us what Kilele Challenge is about? I'm sure a lot of people maybe have not heard about it. Some may have. But tell us a bit about what is Kilele Challenge, how it fits into your broader mission as Kilele Health, especially for awareness, for detection, and also just for overall support for cancer survivors.
Well, the 6th Kilele Challenge. Kilele Challenge was the initial flagship program that we started. And the premise is very simple. Recruit people who have never been beyond a hill. Maybe the highest they've climbed is an anthill.
Yeah.
And in 6 months to 9 months, turn them into advocates who will climb their inner mountains of fear and stigma to be able to talk about cancer, who will climb the physical mountains by actually preparing to submit Mount Kenya, the highest point in the country and the second highest mountain in Africa, to summit the social mountain, which is the stigma in the community, by going out boldly, speaking about their lived experience and tying it to community behavior change communication that leads to action. And also to monetizing their experience so that they have an income. Because most often cancer can be impoverishing in the sense that the resources have been diverted to treatment and this woman is now left with go back to the community. With what and how?
Exactly.
Kilele Health, as we're gearing for the 6th, yes, we've climbed 5 times.
Wow.
Twice I've submitted Mount Kenya.
Amazing.
With survivors.
Yeah.
It's not for the faint-hearted.
I
So
can
Sharon,
imagine.
if you're coming on,
Yeah.
I can promise you this year you will love me and hate me in equal
I need
measure.
to really prepare myself.
But as you're loving me and hating me, you'll also love the survivors that we hike with.
Yeah.
You'll love the amazing mountains they're surmounting internally as well as externally. And you'll love the sceneries that we visit. We go across the country, choose scenic points. This year we're following rivers and we're also following hills that have meaning.
Wow.
Yes.
Amazing,
And why?
Yeah.
Rivers, because rivers bring rejuvenation. Hills that have meaning, because we want to drive awareness education in the communities, in far-reached or marginalized communities,
Right.
but also to leave a lasting impact with them, to realize the goal that they have for health. We want to normalize hiking and walking as part of health ownership. We also want to normalize healthy conversations around cancer and prevention and early detection. What are we looking forward to? I'm hoping we get people who have louder mouths than myself, maybe on their keyboards or by their own written spoken word, to join us as a movement. I'm hoping our survivors who come on board right now I don't have an idea of who the team is, but we're gearing to start recruiting. I'm hoping when they come on the table, they will piggyback on the success of the last 5 years, but this time say they want to do something bigger. And because one of the things that we're addressing this year is healthcare financing, domestic, innovatively. Where we are saying corporates that want to make a difference in the society, as opposed to looking for money pumped into a project, photos taken, and bye-bye, we're happy. Start thinking sustainability, both for their internal corporate awareness and wellness, as well as for the community. And they also start seeing the benefit of being champions for hope and champions for change in the spheres of influence. That's basically it. So September is when we usually summit. Before then, we'll have a team of survivors. Before then, we'll have hiked at least 6 to 7 hikes across the country. Before then, we will have recruited maybe influencers and people who have wider reach to be able to come on board and rally their champions around themselves to be able to fundraise for our activities. And lastly, we'll have identified the villages that we will go to with impact from the resources that are raised so that we can be better able to do more, be more, and serve more in the community. That's our goal.
So the influencers, what are you, I know you're still in the pre-planning process. What are you thinking? Are you thinking Kenyan? Are you thinking global influencers? What's different this time?
Yes, definitely. I love the idea of global influencers. But global influencers are global in the term, but they are also local in that they also have the people who follow them from their own local locations. So as opposed to seeing it as we're climbing Mount Kenya, let's also see it as we are global as influencers, but we are also impacting the people around us. It would be lovely to see people from, for example, from the UK join us and start hiking their hills in the UK to raise funds to support this movement.
Absolutely.
It would be amazing. As opposed to sitting and thinking, I'm local, I'll be going to Kenya. Think, I'm a local in the UK, but I'm global in the universe. And we're making change right where it's needed. And because Kilele Health also has the African Cervical Health Alliance, my hope is that we can demonstrate this is doable in Kenya. And maybe next year we target all of Africa. Because the same challenges we're facing locally are the same ones that our member constituents are facing across the globe.
Wow, I look forward to seeing how that goes. And just to take you, you've touched a little bit on global funding. You've also touched on, at the same time, local innovation. So I'm curious to know, how do you think African organizations are innovating, especially to continue delivering care for cancer? So what do you think maybe is the role of technology and AI in helping, especially in prevention and diagnosis, or even to just help in patient support? How do you see these tools currently working, or rather even shaping the future of help or of actually care in cancer?
I think what AI is doing for us is leapfrogging scientific innovations into adoption faster in Africa. And I say this because I've been involved in programs that have been exploring how we can bring, for example, breast care closer to the woman to reduce the distances they have to travel to get a mammogram. Or how do we make access easier so that we're not leaving anyone behind in need of care? Or how do we ensure one doctor who is supposed to be serving 100,000 people is able to cascade that knowledge to as many people as possible? We ourselves as Kilele Health run the ACHA Advocacy Echo, where every month we are reaching about 300 advocates from across Africa to be able to cascade knowledge on advocacy, cascade knowledge on new technologies. And all this is about information. So AI for me is the solution to partly close the care gap in the sense that we can reach information and technologies faster, but also it's a feedback mechanism to be able to see what is happening in Kenya. Is it also similar in the rest of the African continent?
Right.
And how do we formulate solutions that can quickly be cascaded across the regions? But the other thing, and this makes me smile, we have a project, IEC materials, information, education, and communication materials that we are cascading across Africa. Why I'm smiling is because I've seen the change that AI can do. Our creative director on this project is able to take material done in Kenya, work with technical experts to translate it into French, and then create imagery of women in Cote d'Ivoire to utilize as images for that work, customize it to Mozambique, Portuguese speaking, customize it to Tanzania, Swahili speaking. And if we need to change them to Maasai, we will also change them to Maasai.
Yeah.
And so for me, it's that quick turnaround time. I remember in my marketing days when we would brief a project and design will take forever. Action will take forever.
Right.
Before you come to communicate it, that bus has sailed. Now, at the touch of a button.
Exactly.
It's amazing.
Yeah. I mean, I'm very happy to hear that you're also looking into utilizing AI, even as Kilele Health.
Oh, and there is one other thing. Translating scientific knowledge into solutions, and also the relaying of information in healthcare. For example, and this is something I'm advocating for strongly, if a woman has negative HPV test result, unless there is an absolute need for us to bring her to the healthcare system, she can get a text and be told, come back in 5 years. And then AI will help to diarize that and a reminder in 5 years to remind her to come back for the check. No need to bring her to the healthcare system. And AI can also be used for those gentle reminders for the woman who has been found to have positive results to be reminded. Women today have their gadgets. Let it be another reminder. Hey, you're due for a checkup. Hey, you're ready for a follow-up. Hey, come, somebody will walk you the journey. And that automation reduces the need for healthcare workers because we have so many other health priorities.
Totally.
So we need to reduce that gap to service provision.
Yeah, I absolutely agree on that. Yeah, and I mean, gladly we can say that digital penetration now in Kenya is we really are at a place where you will even go to mashinani and lots of people now have smartphones. So if we can utilize AI to help, especially with the cancer care gap, then I think we'll really get to a different point.
Absolutely.
Yeah.
Absolutely.
So just to wrap up, Benda, so World Cancer Day is a global moment. And there's a lot of awareness around World Cancer Day, but action is what really matters. So what is one concrete thing that you think global health institutions, donors, or even individuals can do to help close the cancer care gap in Africa? I know you've mentioned a few, but maybe just to look maybe from the global side, what do you think maybe probably global institutions or even donors need to do to help with this?
Closing the care gap. And this is where we've been talking about all the things, equity or inequities of healthcare. And this is also where we've been talking about what are the barriers that we have and what can we do to address them. I am privileged to be the global co-chair of the UICC, the Union for International Cancer Control, Cancer Advocates Program. And this is a movement that helps us to build capacity and encourage collaboration amongst organizations within the UICC, ensure that cancer care reaches the most vulnerable, the most needy, and also we address issues across the continuum of care. Why do I say this? I tend to think that innovation is what happens when we have the problem. There is solutions elsewhere. How can we marry the solutions that are working to be able to be cascaded to the current challenges that we are facing? And UICC has made it very easy for us to share information, network, and work together. Because of that, for me, focusing on equity, focusing on ensuring that we're leaving no one behind, the World Cancer Day movement gets us to pause for a moment and to say, where are we at?
Yeah.
You will notice countless organizations. There are over 1,700 member organizations of UICC. You'll find that they're doing amazing work. And out of that global platform, we'll be able to see what is possible for us to implement locally and how can we innovate to make it culturally acceptable. The second thing is it's a policy and advocacy platform. This is where governments also have to stop and notice. The color is actually orange. So you cannot ignore orange. Because of that, we use that opportunity also as a movement to create awareness, education, to sensitize governments on what needs to be done, and to ensure that as we're talking about big terms like UHC, we can culturalize them and normalize them in our own settings by highlighting what are our unique challenges and how can governments step in to bring solutions to our people.
Great. Thank you so much, Benda, for joining us. Is there anything you feel like you need to maybe leave our listeners with, or anything that you think we've not touched on before we close?
First, thank you for having me on this podcast. I often look at communications as two-way. So it would be nice to get feedback from your listeners. When they hear what we're speaking about, let's engage. And lastly, Kilele Challenge is coming. Hashtag Kilele Challenge. And Kilele is a Swahili word for summit, or reach the apex, or reach the top.
Exactly.
It would be beautiful for people listening in to start engaging with us and see how they can also join the movement, both for their own health benefits in walking. So let's create a global movement, but also to support those people who they may never meet, like that woman I meet in the street and who will say thank you.
Yes.
You just don't know who you're helping if you help out. And because for us, we are the Robin Hoods, you'll give us, we'll give to the community. When they say thank you, that thank you goes to you. Thank you so much for having us.
Amazing. Thank you so much, Benda. You've really given us a clear reminder of why we need to look into, especially cancer care in Kenya, where we are at, like you said, and what we need to do. To our listeners, thank you for tuning in. This has been Voices in African Health. Be sure to follow us on Podbean, Spotify, or Apple Podcasts so you don't miss future episodes. Until next time.
Asante.